Hello and welcome to today's episode of Health University, where I'm so delighted to introduce to you Dr. Darren Ingalls, and we're going to speak about endometriosis today. But let me tell you a little bit about Dr. Ingalls. He is a licensed naturopathic doctor. He's an author, an international speaker, and a leading authority in environmental medicine. And we'll hear how environmental medicine and endometriosis have a relationship. Dr. Ingalls overcame his own 3-year battle with Lyme disease, using diet, life management, and natural therapies. And he was subsequently diagnosed with multiple sclerosis and continues to use these same tools to manage his symptoms and control his MS. He's now treated thousands of patients with chronic illness using his novel approach, many of whom have gone on to live healthy, symptom-free lives. And that's really the name of the game, right? A healthy, symptom-free life. For purposes of today's conversation, we're going to talk about his experience as an advisor of 20 years to the Endometriosis Association, and then what he will do to help share with his knowledge with us so you can know what signs to look for, what to do, and where to go next if you find yourself with a diagnosis of endometriosis. So welcome, Dr. Ingalls. Thanks for joining us today.
Oh, my absolute pleasure.
Thank you, thank you, thank you. So let's talk about you. Usually there's a reason we get into the things we get into. So if you could give us a little background, how did you get involved in endometriosis treatment?
I know, right? Seems kind of strange that you got some dude involved in endometriosis. And it's funny, again, I'll take a very long story short, but my ex-wife was diagnosed with endometriosis. Actually, she wasn't diagnosed when she had symptoms like most women with endo.
Mhm,
It was
mhm,
probably well after a decade of her having horrible
mhm.
periods and cramps and migraines and being absolutely debilitated. And through her experience of watching what happened when she was dealing with her conventional doctors, and we were actually fortunate that we met someone who did cranial sacral therapy, who helped her a lot, who referred her to an acupuncturist that was a game changer because now she was getting educated about proper diet and acupuncture and Chinese herbs. And it was just a game changer. And I was on a path to become a medical doctor. I was a clinical microbiologist first, and I'd never heard of naturopathic medicine. And the acupuncturist had told us about naturopathic medicine. I started looking into it. I'm like, wow, I mean, this is sort of philosophically aligned with what I believe and certainly what I had experienced. And
Mhm.
so I became a naturopathic doctor, and she ultimately became an acupuncturist. So it was really a cranial sacral therapist that kind of pivoted two careers, but I really is because of her experience with endometriosis that I became a naturopathic doctor.
That is amazing. That is amazing. Well, what would some people, some women out there listening want to know about what signs to look for? Like, what are the symptoms? When might it come on? The experience, the pain that you just described.
Yeah, for most women dealing with endo, it usually starts pretty much when you start your period, whatever age that is. And it's, particularly when your period starts or even right before your period, it's pelvic pain and cramping. And when you have your period, it's heavy bleeding, heavy clotting, gastrointestinal symptoms, nausea, vomiting. I remember my ex-wife used to describe it like, she goes, I feel like someone shot a bottle rocket up my rear end
Oh,
because a lot of these endometrial implants can get in and around the bowel. Bladder issues,
mhm.
irritable bladder, interstitial cystitis,
Mhm.
migraine headaches are very common. I think the red flag is like, when, young women are starting their menstrual cycle and from the get-go, it's already a problem. That for me is, worth investigating. And
Mhm.
interesting, kind of going back in, my ex-wife's history anyway, we confronted her doctor, a decade later. It's like, why? And there was a family history of endometriosis. Like, why didn't you pursue this further? And
Right.
he's like, well, you were too young. I didn't want to put a young girl through surgery. I'm like, so you'd rather have someone be miserable for a decade than at least try to give some relief? And the answer was birth
Mhm.
control pills. But even on birth control pills, it wasn't enough.
Right,
She still
right.
had a lot of issues. So, Um,
Well, and even on birth control pills, it really is masking, and the problem continues to grow. I mean, the birth control pill can't always suppress everything enough to not continue this endo growth internally as estrogen rises and falls. That is
right.
so sad. I recall having a patient, a young woman, a young teenager with pelvic pain, and I sent her to a reproductive endocrinologist because I had been working in the fertility field. And she sort of looked at me askance, like, why are you sending this child to me? And I said, I think she has endo based on her symptoms. And sure enough, and thankfully, this reproductive endocrinologist was a surgeon as well and was
Yeah.
able to help her. I mean, we just think of her, as you say, the years she could have suffered without any relief.
Well, I feel grateful for the experience. It was horrible at the time. I mean, this was before I knew anything about medicine. My ex-wife had 3 surgeries before I finished medical school. And at that point, obviously a little bit wiser and understanding more. And then after kind of implementing all these other things, she never had another surgery after that.
Mhm.
So, I think if we kind of utilize the tools that we at least that I now know about, in terms of, again, managing diet, managing the immune system. I don't think a lot of women understand that endometriosis really is an autoimmune problem.
Mhm.
The reproductive endocrinology people and the surgeons see it really as a surgical issue. We just need to cut it out. Of
Mhm.
course, I think it's about 2.5 years that you end up going back into surgery after they do that, because these implants will come back if you don't do anything else.
Right.
Now, my experience is that if we deal with the immune system and all these other underlying issues, we can prevent women from having to go back under the laparoscope or the knife to do another surgery. And
Mhm.
I've been fortunate that a lot of women, they've been one and done.
Yeah.
They had that surgery because they had so many implants. And look, if you've got stage 4 endo and your pelvis is covered, it's very hard naturally to undo what's already there. But if we can kind of clean the slate surgically and then from there out keep your tissue happy, again, I think you have a very high probability of preventing having a relapse.
Let's talk about the how. So how might a person either avoid surgery if she is not to the point of stage 4, or, post-op really begin to implement some strategies so as to not have to go through that again?
Yeah, I mean, it's a lot of different things. Diet hands down is really the foremost thing I think has the biggest impact, and
Mhm.
really following a low glycemic diet. Blood sugar makes a big difference with endometriosis. We hear this a lot in the cancer world. We know that cancer cells thrive on sugar, and regulating your insulin makes a big difference. I kind of see endometriosis as kind of like a benign cancer.
Mhm.
Although it's
Mhm.
not cancer, the way these cells behave, because they grow at a different rate than your regular endometrial tissue, these implants, when you look at them under a microscope, have a little bit of cancer-like quality.
Mhm.
So it's not cancer at all. I want to be crystal clear on that.
Yeah.
But how the
It's
cells
not
behave
technically
is
cancer, it has an activity
but
similar.
metabolically,
Mhm.
we now recognize cancer as a metabolic disease. And I
Mhm.
think endometriosis, in the same vein, is a metabolic disease to a certain extent. Because so many
Mhm.
women I've seen with endo, they have PCOS, polycystic ovarian syndrome. They've got some element of insulin resistance. It makes it a lot worse. So
Mhm.
if we can start to control your blood sugar, keep your insulin levels low, that seems to make a big difference. So it's really about getting rid of all the junk food, processed food. You want to be eating, foods that haven't been touched much by hands. When you go to the grocery store, you shop the perimeter of the store because that's where all the real food is. Everything in between is just kind of junk filler stuff. So if you're eating whole foods and eating organic, I think is really important if you're dealing with endo. Hormones, since endo is an estrogen driven condition, this external estrogen that you can get from other products or things, even chemicals that mimic estrogen, can bind to those receptors and stimulate those implants, which of course makes everything so much worse.
Right.
So, eating organic as much as possible. And again, we're fortunate that at least in the United States, the largest retailers of organic are Costco, Walmart, Target. You don't have to go to Whole Foods or some of the fancy health food stores to get good quality organic food. It's
Mhm.
really become a lot more affordable in the last decade. And
Especially frozen.
Absolutely. I think especially with vegetables that aren't in season,
Mhm.
you can often find, organic frozen vegetables, which are fine. I mean, all they are is they're literally just frozen. They're easy to recook and they've got all the nutrients and they're organic. And that's
Sometimes they're more nutrient dense than the fresh if the fresh has been sitting on that perimeter for a bit. So yes.
exactly, even some of the fruits, you can get some frozen fruits and things like that. So it's not a stretch anymore. Again, regardless of what your budget is, it is doable if
Yes.
you're making a conscious choice to think as food as medicine and not just something you need to sustain yourself. You're really using this to reduce inflammation, keep your gut happy, keep your tissues happy, and eat nutrient dense foods. And you do that, I mean, a lot of chronic illnesses get better, including endometriosis.
Mhm. And you talked about, sort of the estrogen mimicking, activity of some of these, frankenfoods, but it's not just the food, right? It is our personal care product. It is sometimes our, formaldehyde riddled bed linens or, the water resistant or wrinkle resistant clothing. So really cleaning up the internal environment and the environment in which we live, I think is so important. And I know you wanted to speak a little bit more about, the possibility of, how shall I say this, imbalances in healthy flora, bad flora, molds, and so forth. So I'll zip it and
Yeah.
listen a little longer.
No, you're exactly right. Our external environment has a huge impact on our health. We live in a toxic world. I mean, there's no mystery of that. The average American gets exposed to 88,000 toxins. Less than 200 have actually been tested for long-term safety. So we live in toxic soup, and we just don't know the degree to how much it bothers us. And of course, a lot of this is genetic. A lot of it depends on where you live and what you're exposed to. Obviously, people that live out in farm country where they probably have higher pesticide, herbicide exposure. People who live in urban areas, it's more petrochemicals and mold and other types of things. So it's kind of, choose your poison, but control as much as you can. Your indoor environment should be a safe haven. Like you said, it's the personal care products, it's the things you use in and around your house to clean your house, on your lawn. You want to get rid of all the toxic stuff and replace it with something that's more natural, healthy, that isn't going to bioaccumulate in your tissue. And again, these things, these we call xenoestrogens, these chemicals that mimic estrogen, can be terribly problematic. We see this now in our young girls. I mean, we got girls now that are starting their menstrual cycle at 8, 9 years old.
Or
That's not
longer.
normal. It's all these chemicals in the environment that are stimulating estrogen, and that's why we see this precocious puberty. But you can imagine what that does to a woman with endo, or
Mhm.
can. So, control what you can. Again, can't control when you walk out your front door. Not much you can do about that. But I think if you can at least make your home a safe haven, that's a big get. And you
Yeah.
mentioned about, gut health. Again, I think that's another really important factor of controlling any immune or autoimmune disease, since 80% of your immune function stems from the gut.
Yeah.
So if you're not digesting your food well, absorbing your food well, having regular daily healthy bowel movements without having, reflux and heartburn and constipation and diarrhea, blood, mucus in your stool. I mean, these are all signs that your gut is not healthy and not doing what you want it to do.
Mhm.
So, we want to make sure that you are digesting and eliminating appropriately. And we're fortunate that we have a lot of good functional labs out there that can measure this so we don't have to guess. Our gut is, I think, way more complex than we truly understand. We've kind of evolved in our technology that we can measure all these interesting things found in our gut. Again, I don't know that we really have a sense of what should be there because,
Mhm.
we don't find anyone out there that's never had antibiotic exposure, only eaten organic food, never been on a medication. If there's a person out there, I'd love to meet that person because
I'd
I
love
don't
to
think they
interview that
exist.
person for sure. Yes,
Yeah,
yes, yes.
maybe there's someone in some, remote third world area that has that kind of, diet and lifestyle. But yeah, I was a former microbiologist and I think a lot about this. I'm like, what does the ideal gut really look like? What should it look like? What should our balance be? We know your gut, from about the time you're born till 3 looks a certain way, and then it shifts a little bit. And then from after 3, you kind of have your adult microbiome until you get to be much older, and then it shifts once again as you get into your later years. So, yeah, what is that ideal composition? And we may get to a point where we really understand that, but
Well,
without having that being able to pinpoint exactly what it should be, we at least can get enough information to see, is there an overgrowth of yeast? Do you have a bacterial overgrowth? Is there a parasite? Are you not digesting your food? So I like to test and not guess. You
mhm.
know, so many people spend, hundreds or thousands of dollars on supplements and herbs that aren't really serving them well just because we don't know. So let's cut to the chase, figure out what's really going on so we can give solid recommendations.
You can do some targeted treatment. Thank you for sharing in our conversation here at Health University. One of the ways in which we help people improve their fertility is through our 5-element fertility quiz. Please click on the link below at yourfertilityquiz.com and take this short quiz. You'll receive a free report that includes easy to implement ideas to improve your whole health and your fertile health. Now let's return to our topic in today's episode.
Yeah.
And you mentioned earlier on that there are natural things that we can do. Of course, as you say, it starts with the gut. But what about botanicals or therapies that might help the person with endo quell that fire so that she's not in this state of sort of recurrent inflammatory, I don't even know what to call it, gerbil wheel.
Yeah, I mean it's a really tough place when the pelvic pain, the endo pain gets out of control. It's very hard to function, and obviously we want to keep women as functional as possible.
Mhm.
And yeah, there's some great herbal natural anti-inflammatories. I think curcumin is probably the most well-researched anti-inflammatory we have. They've done studies comparing it to Celebrex, comparing it to Vioxx, and found it works as well or better. Very important with curcumin is sourcing it. I'll say
Mhm.
not all curcumin is the same. And taking turmeric, by the way, is not the same. Curcumin comes from turmeric, but just eating a bunch of turmeric in your food, you won't get enough curcumin to probably make a difference. So you want to get a pure curcumin extract. And I find most people have to take quite a bit of it to get the clinical effect. It's also very important that you take curcumin with food. It needs the food for absorption.
Mhm.
But I've used that. Herbs like boswellia or frankincense is a weird anti-inflammatory. White willow bark, that's where they discovered aspirin is a
Yes.
good anti-inflammatory. There's one called Harpagophytum or sea cucumber is a good
Mhm.
anti-inflammatory. So we have quite a few botanicals that you can use internally. Again, castor oil packs over the pelvis can be incredibly helpful.
Mhm.
Just make sure if you're going to do castor oil packs that the castor oil is organic and it comes in glass.
Right.
Castor oils usually they put it in a brown plastic bottle, and again, we just talked about reducing chemicals in your world. We don't want to put more chemicals through the skin, but again, I've had a lot of women with endo that be doing daily castor oil packs. Helps with blood flow to the pelvis, gets rid of a lot of that pelvic congestion, which is so common with endo, and can help reduce pain. And again, it's very inexpensive and easy to do.
Yeah. Yeah. Wonderful. Wonderful. What you had mentioned, or maybe in another conversation where you talked about like the immunotherapies. So what kind of immunotherapy, since we know that endometriosis is an autoimmune condition or has autoimmune-like activity, what kind of immune therapy? So the pain relieving of the curcumin and the white willow and so forth is helpful symptomatically, but are there things someone can do to actually change the physiological pattern, if you will?
Yeah, absolutely. We find that in this element of autoimmune issues, there are different triggers. Again, it can be food, mold, chemical, pollen. So part of it is first trying to identify what are those immune triggers, and there's different ways that we can test people to see what that is.
Mhm.
But then, yeah, using immunotherapy. So the idea, most people are familiar with allergy shots.
Right.
If you go to the allergist and they say you're allergic to dust or ragweed, every week you go in, they inject you with dust and ragweed. And then each time they keep giving you incrementally a little bit more until you get to a point where then you're kind of in a maintenance dose and you stay on that for many years.
Mhm.
The concept is the same, is that by giving you the thing that you're sensitive to or allergic to at a very specific concentration, we're actually starting to build immune tolerance back to that compound. All
Mhm.
allergies and sensitivities at their core are an overreaction of your immune system. So we just want to retrain your immune system to stop overreacting so we can get you to a point where you can be exposed to this thing and it doesn't set off that inflammatory cascade anymore.
Yeah.
So I find, again, food sensitivities are incredibly common in women with endo. often, there are environmental sensitivities. It could be mold, it could be pollen, it could be animal dander. So we kind of, go through depending on the clinical history, where you live, what we think are the biggest triggers. And, chemical exposures, again, are very common. I have women tell me, if they go to the mall, they get a headache, it's all the outgassing of formaldehyde and phenol, or if they go to a nail salon where it's toluene, benzene, if they're at the gas station and just being around the gas pump, the petrochemicals bother them.
Mhm.
Chemical sensitivities, again, can be a problem. And the one that was really eye-opening to me, and again, I learned this many, many years ago, there was a doctor out of Wisconsin, Dr. Wayne Konetsky, that was lecturing at an environmental medicine conference about progesterone allergy. And I'm
Mhm.
sitting there thinking, that doesn't progesterone allergy. How can anyone be allergic to their progesterone? I mean, wouldn't you die if you were allergic to progesterone? Well, I use the term allergy loosely. I mean, not allergic like anaphylactic, but sensitive.
Right.
And indeed, we started testing people in our clinic. We often found a lot of women with endoprogesterone sensitivity was very common, but we would hear this in the history. When's progesterone highest? It's in the luteal phase, the second half of your cycle. Well, the second half of the cycle is always worse. So maybe it's because the progesterone level is going up. Or at any point, if they were going through IVF or anything where there was external progesterone being added in, I took that progesterone and I just felt awful. I felt so much worse. Well, you shouldn't feel worse, right? You should feel better. So maybe that's an indication that you're actually sensitive to that molecule. And if we talk about autoimmunity, I don't think autoimmunity is selective always. In the case of like rheumatoid arthritis, it's your joints, and MS, it's the brain, and lupus, it's different tissues. Well, why can't your immune system target something like progesterone or serotonin or estrogen?
Right.
And again, we test people fairly routine in our clinic on these things, and we find hormone and neurotransmitter sensitivities come up pretty regularly.
Mhm.
But again, often we'll hear the history. If someone's sensitive to serotonin and they went on an SSRI drug for mood or depression and they felt worse, well, it kind of a clinically tell me that, yeah, I mean, again, if you're allergic to ragweed and I shove ragweed in your face, you're going to sneeze.
Mhm.
So if we're giving something to try and drive a pathway that you're actually sensitive to, you're probably going to feel worse. So
Interesting.
that's at least the clinical indicator, and then we test and confirm that that's actually what's going on. But I've seen women with progesterone sensitivity. We start desensitizing them. Wow, my period is more regular now. I'm
Mhm.
not having as much clotting. I'm not as much cramping. Is it going to get rid of endo? No.
Right.
Is it going to help manage the symptoms a little better? Probably.
Yeah.
So,
Yeah. And also the mood lability, I would imagine,
yeah,
would really shift, to have her feel a little less, crazy because it's crazy making to be in pain.
yeah.
Hmm.
Yeah. So I think, it's the whole body burden we're really trying to assess. It's really never one piece. It's the combination of all the pieces as we put them together. So again, we're working on the diet, we're improving the gut health. Now we're trying to manage the immune system. So as we start kind of, laying the bricks of the foundation of good health, they all come together and we find that again, symptoms get better, periods get better. And again, if endo's really severe, sometimes we go in, do surgery just to get rid of all those implants that are probably yanking and tugging on tissue, causing a lot of pain. But again, more often than not, we can keep people from having to go back under the knife.
Yeah. Yeah, that's great. What about things like proper sleep? How would you say that could benefit or lack of be detrimental to someone who's struggling with endo?
Yeah, well, again, I think a lot of women with endo, because of the pain, sleep gets disturbed. And
Hmm.
if you're not sleeping well, again, if you look at all the sleep research, that's when all the magic happens, right? That's
Hmm.
when your brain detoxifies. That's when the tissue repairs itself. That's when your a lot of your hormones kind of reset. So if you're not getting good quality sleep, that becomes important. And again, I have people say, "Well, I sleep." And again, if you're one of these people who uses a tracking device like an Apple Watch or an Oura Ring, it will usually tell you how much deep sleep you're getting. And even for myself, I used to wear an Oura Ring. I don't wear it anymore, but uh, I was surprised. No, if I slept 7 hours a night, it's like you got 15 minutes of deep sleep. I'm
Yeah.
like, well, that kind of sucks. I mean, that's not good.
Yeah.
And so why? Well, you're uncomfortable, you're restless, you're tossing, you're turning. You may not necessarily wake up, but you're certainly not getting to the level of sleep that we want and need for your body to do what it's designed to do.
Right. To
So,
detoxify and remodel that tissue. Yeah.
right. So sometimes we use natural things to encourage better sleep. Melatonin can be very helpful in terms of falling asleep. Glycine, which is an amino acid, is good for falling asleep. There's other things that are better for staying asleep. But people are
Mhm.
like, you know what, I fall asleep fine, but I wake up in the night and I toss, I turn, 5-hydroxytryptophan or 5-HTP is a precursor to serotonin. That
Mhm.
can be helpful. We have a lot of herbs like passion flower and valerian and kava kava and lemon balm and California poppy.
Mhm.
All these can be helpful in terms of getting your brain into that deeper, relaxed, quiet state so you get deeper quality of sleep. And
Mhm.
again, these are all very safe herbs. Sometimes, medication's needed. I'd prefer to use the natural stuff, but sometimes people are like, hey, look, I've cycled through
Yeah.
10 different natural things. I can't sleep.
Yeah.
Okay, sometimes, a little trazodone or something can help. Obviously, we try and use as little medication as possible,
Mhm.
but
And
it's
maybe for
still
a shorter duration, it's just to kind of.
right. We're just trying to get you back on that
Mhm.
pattern, and hopefully at some point your body will get back in sync and you won't need the sleep aid. But I'm more concerned about the lack of sleep, what that does to people long term, than using a little bit of medication to get at least some sleep and hopefully better quality sleep.
Yeah, beautiful. Okay, so I'm recapping a little bit. We've got nutrition, crucial, ruling out gut infection, really important so that you know what you're targeting. Circulation with the, with the castor oil and, other like gentle walks or yoga or things like that. Proper sleep. Anything else that they were missing in terms of what you would say, to the listeners that you make sure you check this box as well?
Well, you just said it, tick. So, again, I find a lot with endo often have some other type of chronic infection, not just GI infection. So, tick-borne illness, things like Lyme disease, Bartonella, Babesia, a large majority of women with endo also have these concomitant infections. Sometimes it's chronic candida or yeast infections. Sometimes it's chronic strep infections. Sometimes it's a viral illness.
Mhm.
So, again, this low-lying infection can be inflammatory. It can
Mhm.
be a contributing factor to the total body inflammation. But again, and I think it also becomes an immune distractor.
Yeah.
If your immune system's distracted trying to deal with this infection, it's not as efficient at doing what you want it to do.
Right.
So it's important, to test. And particularly, again, if it's not just endo symptoms. I mean, I have a lot with endo that have joint pain, that are getting chronic headaches, that are chronically fatigued, things
Mhm.
that aren't necessarily endo symptoms, but it goes along the lines of having this element of immune dysfunction that you're disposed to these other critters that are out there in your world. So most of this can be done through simple blood tests. Sometimes it's a stool or a urine test, but I think it's important to dig deep into that because I find, again, when we treat the underlying infection, that a lot of these other symptoms do get better.
Mhm. So, people I'm sure listening who say, "Oh, I think I might have endo," or "I know I have endo," they're able to reach out to you, I presume, if they're in the state of California, 'cause you're
We
practicing.
actually work with people all over the world. It's
Fantastic.
not complete requisite. It's great if you live in California. We'd love to see you, but yeah, we work
Fantastic.
with people everywhere.
All right. Well, we will be sure to include obviously your website and resources in the show notes. Also to the Endometriosis Association. Say that three times fast. Anything else? I want to be respectful of your time and also the listeners' time, but I also don't want to miss a pearl. So if there's anything that you want to say, oh, but don't leave this conversation without thinking of this or knowing this.
Yeah, I think the most my final message is that if you already have endo, don't be content with just having surgery every 2.5 years. If you
Mhm.
don't have a team of people around you that's going to help you pursue these other things, find them. And
Mhm.
if you think you might have endo and you're having a hard time getting someone to help you figure it out, again, find someone. There are lots of people out there. When it comes to surgery, I always recommend get in the hands of an endometriosis expert.
Mhm.
Every OBGYN will tell you they can do your endo surgery. I can tell you from experience that you want someone who does this all day long. So the
Mhm.
Endometriosis Association is a great resource if you need a referral for a surgeon. But I think that's important. But sometimes you have to be your own best advocate. Be the squeaky wheel. This is your life. It's your health. And if you feel compelled to do more than you're being told, then please do so.
Yeah, for sure. And I think I would just add one more point to the autoimmune component. I always describe an autoimmune condition as like a toddler having a temper tantrum. Those white
Yes.
blood cells they're deficient, they're weakened, but they're overacting. And because they want to keep us alive, they will find other tissue to act on. So,
Right.
so don't, as you say, don't just settle with, okay, I've got it. I'll get the surgery every couple of years because the possibility, I won't say probability, but the possibility exists that your white blood cells are going to say, okay, I'm still finding invaders here. Don't know what it is, so I'll go look for another set of tissues. So, don't become, someone who's suffering even more when you can get that your symptoms mitigated and a reversal of your symptoms in play now. So I want to
Absolutely.
thank you so much for your time. Again, everything will be in the show notes so that people can reach out to you. I'm so delighted to hear that you do help people who are not just in the state. So that's fantastic because I think sometimes that's a true barrier to care. So
Right.
I'm glad to know that the audience can hear that and hear it again. So once again, I hope that we have a chance to circle back and have another conversation. I can tell already that you are a wealth of information, but out of respect for your time and the listening audience's time, we'll end this podcast as we end most podcasts at Health University by saying today's class is dismissed.
Great. Thank you so much.
Thank you.